We have to talk about America's health with several infectious disease outbreaks surging across the country. You have Texas, where there are 90 cases of measles that have been reported since late January. Health experts worry this could be the tip of a bigger iceberg as the highly contagious virus threatens to spread across county and state lines. Meanwhile, on farms nationwide, bird flu is spreading like wildfire among livestock as the outbreak reaches a very critical point. Just when we need it most, Donald Trump's federal budget cuts have slashed funding for the National Institutes of Health, potentially crippling research and response efforts in the face of these growing outbreaks, not to mention what is happening at HHS. Joining us now to discuss is MSNBC contributor and former White House policy director, Dr. Kavita Patel. And it's important to note, Dr. Patel, you are a real doctor.
She's a real doctor who brings real common sense to the conversation. Dr. Patel, you know, there's been a lot that's been made about bird flu and the seriousness of that. We had John Rust on yesterday, who's the head of the second largest egg producer in the country, talking about the impact of that. But little noticed is what's happening in places like Texas and other communities around the country that are beginning to experience outbreaks, not just of measles, but other childhood-related diseases that, guess what, Donald Trump and his health department, we dealt with. What's your assessment of how this is going to play out with a Department of Health that, and as Simone noted, administration policies that are cutting the research dollars, cutting the funding mechanisms that would support healthier communities?
Yeah, I think so. Several things are happening all at once. You've got outbreaks of, as you mentioned, diseases that candidly most doctors don't even recognize anymore. I think if a case of measles walked in to GW or Georgetown, I know that somebody might think about measles now, but it's not something that we often think about or see presentations of. And it's pretty critical to just kind of note that. Second is not just what you said with like a brain drain from people who are kind of being, left off because they were probationary or DEI hires, but it's also the kind of lack of trust in what's actually on the CDC website. That used to be kind of a trusted website. And as both of you, as Alicia, everybody knows, they scrubbed the sites, took down a lot of information. And it's not clear if all the pages are back. There's kind of an effort that a lot of academic and societies are trying to get together to see what information is missing. It's largely around gender and equity. But in this case, when I go to cdc.gov, can I trust that info? And that's calling into question. So if the very information that guides our clinicians is coming into suspicion, and then we also have outbreaks because people have been now for decades not trusting vaccines, but it's kind of reaching a boiling point. And then you don't have a workforce that can deal with it, both whether it's federal, state, or local, because those funds have been cut and the federal workers that oversee it have been cut. Then you have a recipe for disaster. In Texas, we don't know where those 90 cases are going to top out. Measles is so infectious. One person has it, that if there are around 10 people who are unvaccinated, 9 out of 10 people will get it. It is one of the most infectious viruses that we have, and that's real. You put it into a room, and it's a powder keg.
Dr. Patel, let's talk about that boiling point. As you called it, you have RFK Jr. making his first anti-vaccine moves. This is from the Wall Street Journal. News reports this week say he's preparing to sack members of the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices. This is the group that decides whether and how to recommend vaccines for the public. So if those folks go, who fills that void, Dr. Patel?
Yeah, so I think this is pretty important because most of the time we don't really follow, what are the, processes behind getting a vaccine that's been evaluated and approved. We just kind of take it for granted, to be honest. And so what they did in just making this move on both delaying this meeting and announcing that they're going to be replacing some of these advisors, these are not, just kind of people that randomly showed up on a committee. These are people who have had decades of academic research and real science behind why they are sitting in those roles. And so the idea that they could be replaced, quite possibly and quite likely, with people who have pretty idealistic notions like that vaccines are not safe, for example. And we have plenty of people in the RFK sphere who could come in and say on an advisory committee, well, here's all the science around why this vaccine is not safe. And you could take punches at that science, but at the end of the day, you've got an advisory committee. But remember, all of this then goes to a CDC director that might be the most important position because the CDC director actually has the final power to say, I'm going to take these recommendations or I'm not. And in the CDC director, we've got somebody in the nominee. We have somebody who has been clearly anti-vaccine for decades, back to when I worked on the Hill. He was a representative that was incredibly very vocal about the safety of vaccines back then. And that's not to say there's not true issues and that there might be issues. Every vaccine has kind of an incidence that we have to watch for and warn patients about. But it's becoming replaced, Alicia, with this concept that no vaccine is safe and that you can't really trust even your doctors when they put the vaccines in front of you and offer you the idea of getting prevention for these diseases.
I mean, okay, Dr. Patel. So the Guardian reports that there's been about 972 cases of the bird flu in cows, 89 cases in cats. This is all happening amid a purge of experts at federal agencies, including employees who were responding to the avian influenza outbreak at the CDC. You got that, and then you got this measles outbreak. My question is, if you've been vaccinated for the measles already, should you be concerned about this? Because I thought that if you got vaccinated, it's all good. This is about people that haven't been vaccinated, but maybe now that's not the case. And then can people get bird flu? Because what is going on? I think people really want to know, are they safe right now?
Right. So maybe we'll start with bird flu because that's much more straightforward. There have been no cases of human-to-human transmission.
Okay.
That's what we're all watching for very closely. Why? Because once it's in kind of human-to-humans, right now we have in almost all cases, we have very direct ties to some exposure to some sort of either sick animal or somebody else who is sick that, not a human, but some animal
a cow
or something.
Or a cat, yeah,
domestic cat. I just want to say, like,
they were drinking raw milk, though.
Right. So something that you can trace and tie. If we saw human-to-human transmission, that would indicate two things. One, that the virus is changing. That number two, the threat is much more kind of high because even if you did, as a human, get a case of bird flu from an animal, majority of those cases are mild. It's not something as serious, but we already had a death in Louisiana, so we've got cases that are serious, and they're usually in people who are immunocompromised. So nothing that people should do about bird flu for the majority of the public, unless you actually do work with animals. And I would say if you have domestic cats, have a closer rein in on domestic cats because we have seen the transmission in cats coming from probably dealing with infected birds or other animals and then coming into the household and exposing humans. So that's probably the most practical advice. And then don't drink raw milk because we know that it can be carried in milk as well. So those are practical things. Wash your hands when you treat chicken, bake your chicken, get all those things that we would normally tell you before bird flu. And then measles, you're right. The majority of Americans, if you've received your 2 measles shots, that's about 97% effectiveness. It's one of the highest, most effective vaccines we have. However, there are periods of people who had received a certain version of the shot in the 60s, 70s, and 80s. They might benefit from a booster. You don't need to get your blood work checked. You just need to present to the doctor and say, listen, I was vaccinated during this time period. Do I need a booster? To probably say yes. And then if you're older and immunocompromised, you may want to have a conversation. And then for children, we can give this to children as early as 6 months, first shot, 28 days later, second shot. So if you have a young child and you're going to a cruise, Disney World, a big gathering, it's worth probably thinking about having that conversation with your pediatrician.
You should take care of the health of your children and ignore the stupid that's coming out of this administration with respect to vaccines.
Listen to Dr. Patel.
Thank you. Listen to Dr. Patel.
Dr. Kavita Patel.
Take care of your children, people. Don't, stop it.